everyone, my name is Dr. Romaila and today I have a very special guest with me. Her name is Dr. Divya.
Hi.
And today we are going to be discussing a very unfortunate and sad topic. It's called MAID, Medical Assistance in Dying. And it is something that is legal in Canada. And we're going to get a little bit into it as to what the legalities behind are, what the criteria is, and everything there is to know about MAID. Now, Dr. Divya, do you mind telling me a little bit about MAID, what it is, and why it's done?
Yeah, sure. So first, let me start by saying what's a full form of MAID. It's called Medical Assistance in Dying. So why do we say this? It's something that the physician or the nurse practitioner helps the patient or the person to end their life. It is usually for the person who is already in the end of life or palliative care, and no other remedies don't work on them anymore. It is their choice, and we do give them ample time to deal with it. But we have a lot of criteria to cover, a lot of things to cover before we take this decision to give the patient. So can you tell a little bit about the criteria?
Yes, of course. So some of the criteria that I remember right off the top of my head, the first one would be they have to be eligible for the healthcare in Canada. You know how different provinces in Canada have different healthcare insurances? Like in Ontario, we have OHIP. If a person is eligible for the coverage of their own province, they will be eligible for MAID as well. Another big thing is the age. They have to be 18 and older. And they have to have the mental competence and capacity to make that decision. The third thing is that they should have a medical condition which is irremediable and grievous, and there's no actual cure for it, or the palliative care that they are receiving for it, it's not acceptable to them. So there was another criteria as well, which was their death should be foreseeable. So basically, the prognosis of their disease should be such that they will pass on in the foreseeable future, but that has been removed as of now.
Okay.
And another big thing is mental health. So they have removed or kept that on hold, that if you have a mental health condition, for example, schizophrenia or major depression or anxiety or anything like that, you will not be eligible for it if you don't have a physical condition associated with it. So if your only concern is a mental health illness, till 2027, they have kept that on hold, that you will not be eligible for MAID. Maybe things change after that, but up until 2027, that's the criteria for us.
So that was a very detailed explanation. So I think we should get into the process of it. So first, as soon as the patient meets all the eligibility criteria, as you spoke about, the first thing that the practitioner or the healthcare practitioner would do is they will take a signature and ask the patient to date it on when they sign it, which is like a complete consent from him.
Okay.
That would be the first thing.
Then so like an application.
Like an application, a form, most probably, that he's consenting for the process to be taken place. And then it would be two witnesses, like you mentioned, greater than 18 years old, who completely understand the MAID process. The two witnesses will be completely explain the process, what will happen, what medications will be given, and then they'll be made to sign the form as well. The third step would be consent from two healthcare practitioners. The healthcare practitioners will completely assess the patient first. They would also give the consent that there's nothing, no remedy for anything that the patient is going through, and then the signatures can be taken from the healthcare practitioners, which can be a physician or a nurse practitioner.
Okay.
He has to sign it as well after the assessment. Then a period of 10 days will be given to the patient for him to, like, for the assessment, for any other changes that take place, or even change of his mind, change of his heart. The schedule for the MAID will be taken place 10 days after his signature on the form. If at any point the patient wants to withdraw his consent, he can do it. There is no limitation to it, right? And
so even right at the really end, when you're about to reject, if they want to not go on with it, they can just say no.
They can just say no. They can withdraw it. They have all freedom to do it. Okay, so a 10-day period will be given for them. I think I'm still missing out some things. Would you please help with it?
Yeah, I come to think of one where there is the 10-day period is for those that think that their death might be imminent, or they might lose the capacity, the mental capacity within the 10-day period. So that's a period for them. There are instances where their death might not be foreseeable. So for them, there's a 90-day period where they can be assessed. Their eligibility criteria can be looked at, and different practitioners can take a look at their documents and everything. And in those 90 days, at any point, if they want to change their mind, or if they think that they don't want to go on with it, they can obviously change their mind as well. The unfortunate reality of things is that it is a very sad topic to talk about. because at the end of the day, it is the act of death. This is a thing that is available in Canada for people that are going through grievous medical conditions and that they will pass on more peacefully and they have a little bit control over the end of their life. Moreover, it is frowned upon by a lot of cultures and by a lot of religious beliefs. It is frowned upon, but at the same time, it is something that is legal in Canada. It's important for us to talk about it. It's important for other people to know about it as well. Yeah. And I'm glad we had the chance to talk about it. If you have any questions about MAID whatsoever, you can type in the
Please comment below and we can try to clear it out as much as possible.
Yeah. And thank you so much for watching our video.
Thank you.
We'll see you in the next one.
Bye.